Well, you know what that means. That bouncy little jingle that we play every time Coach Carol Phillips is in the building. You know, just hearing that music makes you feel better. You know?
It is upbeat, isn't it?
That cures a lot of ills right there.
It does.
That 15 or 20 seconds of bouncy music knows that, you know that Coach Carol is here. Coach Carol Phillips, she is the author of the 2-time award-winning 52 Simple Ways to Health.
Well, you know, Ken, I will tell you that you left me with a challenge today because we're following the segment on macaroni and cheese.
We cover all the bases here.
It sounded very, very yummy.
Well, there's still some around. Yeah.
Well, I grew up with my mother's homemade recipe, which was just to die for. So, you know, I was brought up with that love for mac and cheese. It's great comfort food.
It really is. And the buffalo was tremendous. You know, it was really good. But what macaroni and cheese isn't good, right?
That's right.
But Mr. Max in just a little while ago. Carol is here and always busy. What have you been up to lately since last we spoke last week?
Oh, well, I'm excited. We have a guest today that we're going to be getting some great information regarding breast care. And Lisa Delahanty is here from Concord Hospital. And I had talked last week about the event next month where I'm going to be speaking at their great event. We'll be talking about that more in a few minutes. But let me jump right into introducing Lisa.
All right.
Lisa Delahanty is the manager and nurse practitioner from Concord Hospital Breast Care Center. And welcome to the show. And I'd love to hear about how you got into the field that you're in.
Well, thank you for having me. I've been a nurse practitioner for over 30 years in women's health. The first half of those 30 years, I was OBGYN. And when I heard that Concord Hospital was hoping to open a breast center in 2004, I thought it would be a great opportunity professionally and personally to take on that project. And I'm pleased to say we've been seeing patients since 2004, and we're now a nationally accredited breast center. So I'm very proud of the program we have for the patients.
Terrific. I mean, what a great resource for people. And tell us a little bit about some of the statistics regarding breast cancer so we can really kind of get a good feel for, you know, what's going on out there, what you're seeing as far as people being diagnosed and what they need.
Sure. So the numbers for 2017 are for invasive breast cancer. They're thinking about 250,000 cases in the United States for 2017. 250,000 of those will be female breast cancer, and about 2,000 will be male breast cancer. So when you think about New Hampshire, there's probably 1,200 cases of breast cancer in New Hampshire annually, and at Concord Hospital, we see about 200 cases.
So before we go any further, I really want to touch upon that, the figure for men.
Yeah.
So, you know, if there's a man out there listening saying, well, you know what, women go for their mammograms and they go for their regular checkups. Mm-hmm. What do men do, and how do they know if, you know, they might have breast cancer?
So as we were talking, male breast cancer is so rare. There's no recommendation for screening for males, but it is just awareness of any changes. And if a male patient has a lump, it should be evaluated by his primary care doctor and possible imaging to follow. A lot of times, male breast cancer has more to do with genetic predisposition to the disease, so it's important to look at the male patient's family history.
So are there other symptoms, or is it typically just looking for a lump?
Male patients usually just present with a lump and a change.
Okay.
And most of the time, it's normal findings, but on a rare occasion, there can be male breast cancer.
Right, because it can be a lump, but it not be cancerous.
Correct.
Mm-hmm.
Yeah. So breast cancer is the most common diagnosed cancer in women. The incidence is going down in the recent years, and I think it's because of lower rates of screening mammography and possibly lower use of hormone replacement therapy. But the cases have been stable from 2014 on, but from 2006 to 2014, the incidence was decreasing.
Mm-hmm. And so walk us through typically, what if somebody, they go for their mammogram, they end up, finding something, the person, hadn't felt a lump or anything. What are the next few steps if they do find breast cancer?
So usually, patients have a screening mammogram, and something could be found on a screening mammogram. So they're called to come back for what we call diagnostic imaging, which usually is additional mammogram imaging and possibly an ultrasound. Depending on what's found, and if there's an indication for a biopsy, you always want to try to do image-guided core biopsies as opposed to surgical biopsies, because most of the time the biopsies are benign and you save the patient a surgical procedure. But if there is a cancer, you know what kind of cancer it is, so you can make plans for the patient for their treatment. So typically it's image-guided core biopsies for diagnosis. And then depending on the biology of the tumor, the staging, treatment is planned for that patient individually. So there's not one type of treatment for every patient.
And, in the information that you sent me, one of the risk factors, it mentioned past biopsies.
And that has a lot to do with the density of the breast and if there was any atypia on that prior biopsy. So we know women who've had a breast cancer diagnosis are at higher risk of another primary breast cancer. But if patients have had a prior biopsy for dense breast tissue, that's benign, but they still have dense tissue, that's a slight risk. If this biopsy wasn't cancer but atypia, that's a risk factor. So we like to, when we see a patient, we want to know their complete history, breast history.
Okay. And what are some of the typical risk factors?
Okay. So some risk factors for breast cancer. We talked about previous history of breast cancer, family history. We want to know both the maternal and the paternal side. I can't tell you how many times a patient will tell me that there's breast cancer on their paternal side, and that doesn't matter because it's only in the maternal, and that's not true. So maternal and paternal are just as important. Age of menarche, age at menopause. So if a woman has an early puberty and late menopause, she's had longer time with regular menses, so that's a slight risk. No children, age at first birth greater than 30, previous biopsies with atypia, mammogram dense breasts, previous radiation to the chest for Hodgkin's disease between the ages of 10 and 30 is a risk factor.
Okay, and you mentioned people who don't have children, haven't had children, have a higher risk. Do they know why that is?
I think it goes along with the same thing as early puberty and late menopause. So if you don't have a pregnancy and maybe nursing your baby during that time and suppressed, periods, the longer you go with these regular periods is the risk factor.
Now, does that fall under the part of cancer where they just don't know exactly why? It's just proven in the studies?
Right. So these are risk factors that they've seen when they look at statistics, but the thing to remember is 75% of women who have breast cancer don't have any of these risk factors that we're talking about. So there's things we're missing.
Mm-hmm.
Yeah.
Mm-hmm. And you mentioned the family history. And like, for example, with me, my father's mother had breast cancer. But then when I give them the details, she was, into her 70s when she was diagnosed. My grandfather smoked for years and years and years. They didn't exercise regularly. So it's almost like that being a factor, when I add in all the other details, they say that it's less of an issue.
Correct. So when you look at family history, is it a first-degree relative, second-degree relative who had breast cancer or ovarian cancer or other cancers, but also the age of diagnosis. So if you see a family history where there's a lot of relatives with breast cancer, particularly at a younger age than you would expect, before 50, then you start worrying about a gene mutation that increases the risk of cancers in that family. So to have a grandmother that had postmenopausal breast cancer and no other family history, it's a slight risk, but very minimal.
Mm-hmm. And the other thing that I noticed with the statistics is the older you are, the more chance you have of being diagnosed.
So I think I have a little graph that I like to show patients. So, when you hear people say 1 in 8 women get breast cancer, so that statistic is by age 80. So a woman that's 30, a woman that's 40, a woman that's 50 doesn't have a 1 in 8 chance of getting breast cancer. So, for example, age 30 to 39, your risk of getting breast cancer is 1 in like 220. When you're 50 to 59, your risk is 1 in 44. So that 1 in 8 is scary for people, but they have to realize that that's going to age 80.
Right, and that's really important to know because, granted, anything that scares people into paying attention or going in and having their screenings done can be a good thing. Right. But it's not good for people to be dealing with stress all the time because they're hearing these scary numbers.
Right.
Because chronic stress is a problem in and of itself.
Right.
So that's great for that clarification.
Right. And then other risk factors, we talked about being female and increasing age, body weight. So we know particularly postmenopausal women who are overweight, they have more circulating estrogen than a thinner woman. So being overweight after menopause is a risk factor. No regular exercise. Alcohol intake can be a factor, so it's important to limit alcohol intake. And then the screening for any gene mutation if your family is at risk for gene mutation.
And, of course, smoking. Don't smoke.
Yes, absolutely.
But, it's interesting. You mentioned exercise, and just about any health problem you're talking about where you want to reduce the risk, what's on the list?
Right.
Exercise.
Yeah, and for our breast cancer patients, we know that women who exercise regularly after a diagnosis have a lower risk of a recurrence. So when I see patients, and, we're all busy. And sometimes it's the first thing that will go when you're busy. You still clean. I tell them you still clean your bathroom, you still go grocery shopping.
It's true,
but you don't exercise. So that's something you need to do for yourself.
Right. Or when people say, "Well, I have kids now. I don't have time to exercise," and I say, "Exercise with your kids, because now you're exercising and you're teaching them the importance of staying physically active."
Right. So you always feel better after you exercise too.
Right.
So
absolutely. Yeah. The mental and physical benefits.
Yeah.
I just want to jump in and mention that if anyone has a question for Lisa, feel free to give us a call, 1-866-823-1077 here at 1077 The Pulse. Lisa Delahanty with us from the Concord Hospital Breast Care Center. And, of course, Coach Cail Phillips with us and her health segment. Now, you mentioned that smoking is a factor in terms of a risk factor in terms of breast cancer. And you don't hear about too many men getting breast cancer. It's very rare, as you pointed out. How about lung cancer? I seem, and maybe I could be wrong, to hear about more men getting lung cancer than women. Is that true or not? Just a perception that I have.
I don't really know that. I just know that smoking increases lung cancer, colon cancer, bladder cancer, cervical cancer, and we think breast cancer. So there's more deaths due to lung cancer for sure. Mm-hmm. That's the leading cause of cancer deaths in women. But for men,
lung cancer is
lung cancer.
Okay.
But for men, I want to stress that the breast cancer risk is so rare. I think in 15 years at Concord Hospital, maybe we've had 2 or 3 cases of breast cancer.
Wow.
So it's really rare, but, if a male has a lump, it should be evaluated to rule that out.
Mm-hmm.
Yeah.
Good information.
But the bottom line is don't smoke.
Right.
Don't smoke.
Right.
Don't smoke. Yeah. Get moving.
Yeah.
There's nothing good that can come out of it, right?
Right. And, what I'm always promoting is everything in moderation. Don't look for perfection. If you're not taking great care of yourself, you don't have to go from A to Z overnight.
Right.
Any step in the right direction is really important because the human body is very quick to forgive and it always wants to be healthy. So it's always trying to move in that direction. So anything you can do for it is better than nothing.
And I think that's why you'll be a great speaker for our Survivors Day, because for our breast cancer survivors, we don't want them to be overwhelmed with all this information. We want them to make healthy choices for their overall health and lowering their risk, but they can't think that this is all or nothing. Yeah.
Right. And thank you for the segue, Lisa.
Oh, okay.
So
Okay.
go ahead, jump in and
Did you rehearse this, you guys?
No.
yeah, out in the parking lot since about 10 o'clock this morning.
So every year we have what we call our Breast Cancer Survivors Day in October. It's a Saturday program for breast cancer survivors, and this will be our 13th annual one on October 21. And it's a day of education and camaraderie with fellow survivors. And this year, Cail is our keynote speaker, and I'm pleased to say that everyone that is attending will be receiving your book. And then what we
I'm
do,
honored to have been asked.
Two-time award-winning book. Lisa.
Yes, right.
That's what we want to throw in. Two-time award-winning book.
So
Ken's my promoter.
So that will be in the morning, and then we have a luncheon, and then in the afternoon we always do some type of a program, hands-on program, and we're doing herbal terrariums this year, so patients can take that home and have that in their kitchen.
Nice.
So that's our plan, and we have over 50 women that are signed up already. It's free. We have about 20 more openings.
Nice. People can register online, or they can call 227-7000, extension 5303, and we'll repeat that before the end of the show today if you're interested in going. And it's open for anyone who has been diagnosed with breast cancer or any other gynecological cancer, correct?
Yeah, we open it up to both of those. Yeah.
That is terrific. So that's October 21st?
Yes.
Okay.
At the hospital.
All right. You'll have a chance to meet and hear from Coach Cail Phillips and receive the book as well, 52 Simple Ways to Health.
Yeah, it'll be a great day for people to meet each other and bond. And, I'm sure that so many people I had a scare once, and luckily it ended up not being anything, but, just going through that process of testing and waiting and wondering and worrying, and you can feel so alone in those situations. So it'll be a great day for these women to meet each other, or men.
It does my heart good during that day, because we see these women that have done so well, with this diagnosis after treatment, and there's newer patients that walk in and they're, worried about coming to the program, and they're just enveloped in support, and they spend their days talking about their treatment, asking questions for each other, and it's just a great day.
Terrific. Yeah. Looking forward to it.
Yeah.
And certainly it is an important factor of it, the support they get following the diagnosis. And I know, having spoken with a number of breast cancer survivors over the years, that is certainly key, that the support and the guidance they get following the diagnosis.
So at Concord Hospital, we have many different support groups for patients. There's one support group that we do for newly diagnosed patients. I co-facilitate that with the social worker at the Patient Center, and that's for newly diagnosed patients. So we have medical oncology come in to talk about maybe clinical trials, chemotherapy, hormonal therapy. We have a radiation oncologist come in to talk about radiation. We might have a dietitian come in to talk about healthy eating before and after surgery. We have providers come in to talk about mindfulness-based stress reduction. So this is for newly diagnosed patients to help them, get through that journey, make the decisions for their treatment. Then we have monthly groups for other women farther along in treatment.
People newly diagnosed must be so overwhelmed, and then they have choices to make as far as treatment. And how do you navigate through all that? How do you choose if you know nothing about breast cancer?
So I can tell you, typically when I am with a patient that was recently diagnosed, I work with the two surgeons at the breast center, Dr. Sharon Guncher and Dr. Melissa Hoyt. And I can tell you, we tell the patients, look, you're going to get a lot of information today. You're not making any decisions today. You're going to get a lot of information. We're going to make some appointments for you, and then we're going to regroup. So that's the first thing we tell them.
That must be comforting for them.
Yeah.
Just knowing, all right, I can just stop and listen right now and not have to make any decisions.
And we always encourage patients to bring a family member with them. And we've had patients that bring partners, husbands, sisters, family members. So we really encourage that. I've had people on their phone, so I could talk to a daughter in Florida, so we encourage all of that. So we give a lot of information about their diagnosis, what their options are, and then we have them see the rest of the team, medical oncology, radiation oncology, whatever is necessary to make decisions. And one of the things that we do with our patients is that we help navigate them through the journey. So we never tell a patient, you have to make this appointment and we'll see you back. We make all the appointments for our patients. We get all the pre-authorizations for their insurance. So that's something that they don't have to think about. They just have to think about the medical decisions. Nice. So my staff takes care of all of that. And then the other thing I was thinking about initial diagnosis, one of the things I always tell patients when they're first diagnosed, and I say, this is really the most stressful time. You don't have a plan. Once you have a plan, it'll be easier because you don't have a plan. You're waiting for results, and it can be the most stressful time. And once I tell them that, and they think, well, maybe even if I need chemo, it won't be as bad as this. I can see their stress level go down.
Oh, and that is such great information to share because when we don't have a plan, we feel like we're not in control.
It's awful.
And no matter what's going on in life, if you feel like you have a plan, that can make all the difference.
Yeah. So, patients have told me that once they have a plan, they feel better about the whole situation. But for a while, you don't have a plan. You're seeing specialists, you're waiting for results. So it takes a while for that,
Interesting.
Yeah.
Coach Carol Phillips in the house, and along with Lisa Delahanty from the Concord Hospital Breast Care Center. Some great information over the first segment of this program. And if you would like to give us a call, if you have any questions or comments that you would like to make, feel free to do so. 866-823-1077. That is the number. 2:33 is our time. Coach Carol Phillips in the house, along with Lisa Delahanty from the Breast Care Center at Concord Hospital. And Lisa, we were talking during the break, and you have been at the Breast Care Center at Concord Hospital since day one.
Yes, I have. Yeah, in 2004.
Yeah. And it wasn't then what it's like now, right?
No, the first few months we were just getting things ready, and then we started to see patients.
So feel free to share the story that you just shared during the break about when you got there.
Oh my gosh, that's what you're pushing me to do? Okay, so
that's right. That's what we do.
So
if you don't get it from that side, you're going to get it from this side.
I just remember the first day when the elevator opened, walking into the breast care center, and there were plumbers and carpenters and just me. Just me. And so I had to go down to the imaging center and ask for paper towels for the bathroom. I had to walk over to the hospital to ask for paper and pens. And I thought, what have I gotten into? And Dr. Gunsher at the time was in Michigan. She was the medical director that they had hired. So she was in Michigan. So we were emailing about the program.
She knew to not be here yet.
Yeah. And so then it took about 4 months before we were ready to see patients.
Now, were you at the hospital prior to that?
I was at the, no, I wasn't.
Oh, okay.
Yeah.
Okay.
Yeah.
Interesting. So, love that story.
Yeah, so that's my story. Yeah.
You're lucky they didn't hand you a hammer.
I know.
So I'd love for you to talk about the event a little bit more in case people want to sign up before the event's sold out.
Sure. So let me just talk about the date and everything.
Sure.
Again? Okay. So it's the 13th Annual Breast Cancer Survivors Day on Saturday, October 21, 9 to 2:15, right at the hospital. And in the morning, Carol will be the keynote speaker. We'll be talking about healthy behavior, lifestyle changes, and education and motivation for change. And every participant will receive her book, 52 Simple Ways to Health. There will be a lunch, and then they'll be making plant and herb terrariums to
And
bring
it's
home.
free.
And it's free. We're hoping for 60 plus women. I think on the list this morning there were 50 signed up. So just call the Breast Care Center 227-7000 extension 5303 if you are interested. We'd love to have you. And you can go on the Concord Hospital website as well to sign up.
Very good. Thank you for that great information.
Yeah, sure.
So people can sign up online or by calling.
Yep.
And once again, if you've been diagnosed with breast cancer or any other gynecological cancer, you are invited to this event.
That's right. And they don't have to be Concord Hospital patients.
Okay,
They don't
good
have
to
to
know.
be Concord Hospital patients.
Good to know.
Anybody.
So I'd love to touch upon once they're diagnosed, they get their plan in place. I'm sure that it can be all-consuming for some people, especially if you just, you thought you were just going to go for your mammogram, everything's going to be fine per usual, go on your merry way, and then all of a sudden you're dealing with all of this. So how do people navigate through coming up with a plan, figuring out, what they need to do, and then be able to take that aspect of what's going on in their life and put it aside so that the other hours of the day they can get back to some sort of a normal life and move forward and be happy?
So I think part of the answer to your question is how can you be mindful when you're going through
Right.
this, because your mind's racing about, what if, what's going to happen. So there's resources available for these patients. The support groups that I've already touched upon. There's counseling, there's our oncology social workers, there's Reiki, hypnotherapy. So there's a lot of support services that are available to help patients deal with the stress of this.
That's terrific.
Yeah.
So different from years ago.
Right. Patients aren't alone anymore in this journey.
And the whole mind-body connection, what they need to be doing physically
Yeah.
to, be comfortable, but then also mentally.
Right. Right. So there's a lot of resources that we have for patients to help them through this. There's resources for their family members, for their children. So, for the breast cancer patients, I'm one of the contacts that they'll say, okay, this is what's happening and this is what I'm going through. And I'm the one, a lot of times they can say, okay, I'm going to have you see the social worker. I'm going to have you talk to the dietitian. So, if they have one person that they can ask and they can navigate them to the right place. I mean, that's what all my staff does at the breast center.
Mm-hmm. So they have a contact person that they can
who to call for what they need.
Mm-hmm.
Yeah.
And talk a little bit more about the resources for family, because I would imagine, well, obviously the whole family's involved, but I'm sure there are situations where somebody might be diagnosed and they're a strong-willed person, and if they have that plan in place, they're just mentally ready to move forward, but they might have a family member who's really struggling, or a child.
Right. So family members can see the oncology social workers at the patient center. There's therapists for, let's say, couples therapy dealing with this. There's support groups for the children. I know there's one support group that the children do art projects together when they have a family member that had cancer diagnosis. There's a pizza party support group for teenagers. So there's all kinds of different support services that are available.
That's great.
Yeah.
Or they can do mac and cheese, right? Mac and
They
cheese
could do mac
parties.
and cheese as well from Mr. Max. Yep.
That's therapy.
It's good therapy. Yeah, absolutely. Now, I was just looking at your website here, and your genetic counseling program is in collaboration with the Dana-Farber Cancer Center, Cancer Institute.
Yeah, so twice a month, genetic counselors from Dana-Farber see our high-risk patients, and it's for cancer genetic risk assessment. So the genes that can increase the risk of breast cancer are very rare. Only, 5 to 10% of breast or ovarian cancers are due to a gene mutation. But when we identify a high-risk patient or family, we offer them counseling with a genetic counselor from Dana-Farber, because we want to know if there's a gene mutation in the family. So our patients would see the genetic counselors to go over their family history in detail, their personal and family history in detail, and then the genetic counselors would decide if genetic testing is warranted. Up to about 5 years ago, the testing was very specific for what cancer you were concerned about. So there was like BRCA1 and 2 testing for breast and ovarian cancer. There were genes for colon. And now there's multi-gene panel testing where they test for a lot of different genes for cancer syndromes and families. And if you rule out a gene mutation, that's very reassuring for the family. If there's a gene mutation, we know their risk of certain cancers, and they can be proactive. So our counseling program, to meet with the genetic counselor through Dana-Farber, we have a wine tasting event in March. It's held at the Croponi Center, and the funds from the wine tasting pay for the counseling.
Oh, great.
So when our patients see the genetic counselors, there's no charge for that counseling appointment. Testing goes under patient's insurance, but the counseling is a free community service.
That's terrific.
Yeah. So those high-risk patients can meet with the team from Dana-Farber to make recommendations.
Mm-hmm. And that's another thing that'll lower people's stress is this is available to you, and
Right.
it's not going to cost you anything.
Right. So when we see patients at the Breast Care Center, we always take a detailed personal and family history. So if there's family history that's suggestive of our need for genetic counseling, we identify those patients and refer them for genetics. And sometimes patients are referred from their PCP. If they're they can be self-referred, but usually they'll see me first to make recommendations. So we have a really good program for risk assessment for those patients.
Terrific.
Outstanding. 2:43 is our time, chatting with Lisa Delahanty from the Concord Hospital Breast Care Center and Coach Cail Phillips. We give you heaven, a little slice of heaven, every time Coach Cail Phillips is in the house with her health segment, which is outstanding, and no exception today with Lisa Delahanty. She is from the Breast Care Center at Concord Hospital.
Ken, flattery will get you everywhere.
It will, huh?
Right, Lisa?
I do that every day, Coach Cail, every day, even on weekends.
But Lisa's been there since day one.
Day one.
Of the Breast Care Center at Concord Hospital, so nobody knows it like Lisa. And what is the youngest diagnosis you've ever heard of or had at Concord Hospital of breast cancer?
Well, this last year we had a young, late 20-year-old woman, which is very unusual, but
Late 20s.
late 20s, yeah.
Yeah. But the risk increases as the years go by.
Yeah, every year you get older, your risks increase.
Okay.
So it's only 1 in, what is it, for when you're in your 20s versus when you get up to your 80s, and it's 1 in 8, right? It's 1 in 200 and some odd.
Mm-hmm.
So the more,
Yeah.
so, and so that brings us to the point of, sometimes people think, well, I've had my kids, I'm starting to go through menopause, I'm not going to worry about my mammograms anymore or,
Right.
Any screenings, but actually they become more and more important.
Right. So if you're 30 to 39, it's a 1 in 228 risk.
Oh, okay.
So it's even more if less of a risk if you're in your 20s.
Mm-hmm.
But yes, so if age is a risk factor, so women should get their mammograms. Yeah. So that's something we should probably talk about screening mammogram recommendations, because a lot has changed in regards to recommendations. So up to about maybe a few years ago, it was having mammograms every year starting at 40. And then things changed in 2009 with the U.S. Preventative Service Task Force recommendations. So there's a very good article in the journal Cancer that was online on August 21, and it talked about different recommendations for screening. And right now, the American Medical Association, the American College of Obstetricians and Gynecologists, the National Cancer Institute say that women should be eligible for screening mammograms starting at 40. The American Cancer Society recommendations in 2005 stated screening mammograms at 45. So this article in the journal Cancer looked at annual mammograms starting at 40. They looked at biennial screening every 2 years, starting at 50. And what they found was that if you have fewer mammograms to achieve fewer risks, such as the need for a biopsy that ends up being benign, then maybe starting at 50 would be the option. But if the goal is to prevent breast cancer deaths and gain the most life years, they recommend starting mammograms at 40, hopefully annually, and stopping when a woman's life expectancy is less than 5 to 7 years.
Okay, so even more important for people to keep in touch with their doctor and find out what the latest recommendations are for screening.
Yeah, have a discussion about annual mammograms starting at 40, for sure starting at 45. If you're a high-risk patient with some of the factors we talked about previously, then that's a different conversation. So this is just average-risk patients.
Okay.
Yeah.
So communication is key.
Right.
Absolutely.
And the newer technology, 3D mammography, tomosynthesis, is very important because you can detect abnormalities at a much smaller size.
Great.
So always check when you're having your mammogram, is it 3D?
Okay. Great.
Yeah.
Outstanding advice all throughout this hour, and we appreciate it, Lisa. But again, for those maybe just tuning in, remind them of the Breast Cancer Survivors Day coming up. Either one of you or both.
Right. It's Saturday, October 21st, 9 a.m. to 2:15 p.m. You can register online, concordhospital.org, or call 603-227-7000, extension 5303, if you've been diagnosed with breast cancer or if you've been diagnosed with any gynecological cancer. You are invited to this great event. And Lisa, I want to thank you so much for being on the show today. Great information. People, make sure you're talking to your primary care physicians and going for your screenings and, just moving forward with what you need to do to stay healthy and happy.
Thank you so much for having me.
You're welcome.
Thank you, Lisa. Some great information today. We thank you for taking the time to be with us.
My pleasure.
And Coach Carol, I know you have a busy agenda, as always, but you will find time to be with us again on October the 12th at 2 o'clock.
Yes, Thursday, October 12th, 2 o'clock. Looking forward to it.
Absolutely. Well, we appreciate both of you being here today. Thank you.